This is Kiwanis Talk. I'm the host for this evening's program. We're in the facilities of the Glaucoma Center of Michigan instead of in the high school, as we usually where we usually produce our shows. Today, our guest is Dr. Matthew Citron, who is one of the physicians at the Glaucoma Society of Michigan, Glaucoma Center of Michigan. So, Doctor, it's nice to have you here today.
It's a pleasure to be with you today. Thanks for coming to the office.
Okay. I have been, we've had a doctor-patient relationship for over 15 years. I'm sure it's over 15 years because I was your patient before my mother moved here, and that was in 2008. So that gives us a year. 1 year before that would be 15 years. I wouldn't be surprised if it's more than that, a few more than that. And Dr. Citron is, I do suffer from glaucoma, and Dr. Citron has kept it well under control, not just with medications, but also when I had my cataract operation. I believe you performed, it's a laser operation that you do,
Correct.
Which relieves the pressure, helps to relieve the pressure from glaucoma. But the reason we came today is to kind of show the facilities that are involved in a business like this. And you have not just one office, there are 3 locations.
Thanks again, Ray, for being here. Really appreciate you coming into the office and spending time. This practice was founded in 1985 by Dr. Les Siegel, and currently we have 4 glaucoma specialists who work in the office. We have all done training through medical school and then residency in ophthalmology and then a fellowship in glaucoma. Glaucoma is a very significant disease in the United States. It causes significant visual morbidity. About 3 million people in the United States are affected by glaucoma. So the treatment, as you said, for glaucoma is multifaceted. It's can be medical with eye drops and very rarely pills, but also surgical with lasers and actual scalpels and incisions. So stratifying risk for patients, identifying patients that will benefit from the procedures and treatment modalities that are available is really our job. And I'm blessed to work with a wonderful staff, and hopefully we'll get a chance to meet some of them. But our practice has been in Dearborn for many years. We also have a office in Southfield and an office in St. Clair Shores. We do surgery mainly in Troy at the Eye Surgery Center of Michigan. So what you'll see today is our office where we do take care of patients and do many procedures and treatments, but surgery is done typically at a surgical center or a hospital.
Well, the room we're in right now, I recognize it because it's the one you go to first. Actually, you have 2 rooms like this, I think, or maybe more than 2. You have at least 2. And you come in here for your initial checks and everything before you go on to other tests.
Correct. So our office has several exam rooms, and we generally start patients off with a technician, what we would consider a workup to get patients ready for the doctor. On a new patient exam, patient would see the doctor twice, and on a return exam, generally the patient sees the doctor once. So we'll also have an opportunity to see some of the testing modalities that we do in the office. This room is also equipped with a laser. There's a piece of equipment right here, which is, we call that a slit lamp. It's basically a microscope for looking at eyes. But what's interesting about this room is we actually have a laser that we can affix to that microscope. And the laser is quite a small apparatus, but it allows us to do several things for patients to maintain their treatment for glaucoma, and also to help them recover from cataract surgery and improve vision after cataract surgery. So the reason why I point that out is I think many patients, when they hear that they're going to have a laser, envision this massive machine and something that's really quite a large apparatus, but when in fact it's quite a small and delicate piece of equipment to achieve the treatment goals.
Yeah. There are a lot of different lasers for different functions,
Right.
and some are used just for directing optical signals. So because the laser is ultra parallel light, it doesn't what would it say diverse. It doesn't spread out at all.
That's exactly right. And right behind us, we have some imaging studies. These are actually imaging studies that were done on my eyes today, just for demonstration purposes. So
yours look a lot better than mine.
One test that we see up here, and I'm not sure if you're able to zoom in, but these colored pictures are tests called OCTs. And as you were saying, Ray, they use light technology and specifically laser to bounce light off the back of the eye. And at the speed at which it comes back gives us an image that allows us to get a good sense of what's going on with the optic nerve and the retina and better treat patients and follow them.
Yeah. Doctor, you have two of your assistants here that we were hoping to maybe get them a little video time. And where were we gonna take the video of them?
Why don't we go to our camera room and our OCT room, and we can meet Kayla and Andrew.
Okay. We are now here at the OCT test in the office, and Dr. Citrin is going to describe it to you.
OCT is a ocular coherence tomography machine. It uses the power of light to bounce off patients' optic nerve and retina and give us information about the structure and some of the anatomy of the eye that we wouldn't otherwise be able to appreciate. It's a pretty amazing technology that has some uses outside of the eye, but in terms of management, diagnosis, and treatment of the eye, it's extremely helpful. Generally, we'll do this test on an annual basis for patients who have glaucoma, and patients who have retinal disease may have this test as often as once a month. It's really changed our approach to early glaucoma. It allows us to pick up structural deficits in a much earlier stage than we would otherwise be able to pick it up. It also allows us to diagnose some normal variants that in the past we might have called glaucoma, and we're able to appreciate the fact that they fall within a normal range. So it's really an excellent piece of technology, and we're very lucky to have it. Andrew and Kayla are demonstrating the test. Again, we're very lucky to have such wonderful staff.
Dr. Citrin, I just wanted to ask you, you mentioned that people that have retinal issues, they may have this test as often as once a month. So that the implication is that they may have changes that occur that often.
That's absolutely right. And folks who know patients who have macular degeneration, which is a very common ailment in the United States and a very common cause of, in fact, the most common cause of blindness in patients over the age of 50 in the United States who are Caucasian, will know that this test is repeated on a monthly basis to assure that there's minimal fluid, the patients are responding to their treatment. So patients who have macular degeneration, in particular the wet macular degeneration, will often receive treatment on a monthly basis. And the OCT allows the retinal specialist to follow the disease process.
I believe, isn't it true that some of the treatment for that has only evolved in the last 10 or 15 years? Some of I believe aren't there injections now that are helpful?
That's absolutely right. And in fact, I was remembering walking through the airport in Detroit and seeing a retinal colleague of mine who came up to me so excited. And I thought it was so strange because this was a colleague, but not an amazing friend. And he's so excited to tell me this big news that he had heard at a retinal conference, which was the patients who had macular degeneration were responding to this treatment. And patients who in the past would have absolutely gone blind from this disease were actually recovering vision, which at that point was absolutely unheard of. So it's really one of the great miracles of eye care in this century, and really actually one of the great miracles of medicine altogether.
Now we are at the famous visual field test, which I have taken probably about 20 times, and it's a challenge. I will let Dr. Citrin describe it further.
Ray, imagine the doctors holding their fingers to your right and left side, asking you, how many fingers am I holding up? What they're doing is assessing your visual function in the periphery. And we know that in glaucoma, the visual function in the periphery is frequently and most commonly the vision to go. Unfortunately, patients don't realize that vision is missing, and the diagnosis of glaucoma can be delayed for years if we wait for patients to become symptomatic. The visual field identifies those visual deficits and allows us to make a diagnosis of glaucoma earlier. And for our practice, the visual field allows us to follow glaucoma to see if it's progressing. So the field has two very important functions. Number one, in the diagnosis, and number two, in the progression of glaucoma.
So there's a term, tunnel vision. Is that used to describe some of the symptoms that glaucoma shows?
In a patient with very severe or end-stage glaucoma, tunnel vision would be a very appropriate description of typical vision. And there's other ocular and neurologic causes of tunnel vision, but glaucoma is certainly one of them. We started off as physicians holding fingers in the air to assess visual fields. We had advances in perimetry that allowed us to do this in a different fashion. And this automated test actually allows for a very efficient and intense assessment of the patient's visual field.
And not only that, it's all 360 degrees. It's not just right and left, top and bottom. It's the whole perimeter of the eye.
That's exactly right. And while our patients, don't love the visual field test, it actually is much more efficient than it was at one time. So the original automated perimetry test could take up to 30 minutes per eye. And currently, an efficient visual field test taker can do our automated test in about 2.5 minutes per eye.
I'll try real hard in the future to be serious about it and really concentrate when I'm taking my visual field test. And all our viewers, you should too. Well, now we're in the room with Dr. Citron, where the preliminary discussion of surgeries, eye surgeries, are discussed. And of course, one of the major ones is cataract surgery, which I experienced with you. And I'm going to turn the mic over to you, doctor, and you can talk a little bit about that procedure.
So, Ray, one of the most common surgical procedures performed in the United States is cataract surgery, and there's about 2 million cataract surgeries done last year. The famous quote of death and taxes, I would add cataract to the unavoidable, effects of life. And when we do cataract surgery, it's generally a very positive change for patients. It's quite an amazing surgery that's evolved, as we talked about the evolution of some of the things in ophthalmology. Cataract surgery has really improved and become, I wouldn't call it routine, but certainly a very effective, safe surgery.
Doctor, let me make a comment that after my cataract surgery, basically, I don't need glasses to drive. I do need them to read. I need them because I'm now I'm farsighted. Okay, I need them to read the instrument panel, but not to drive. So I don't have that requirement on my driver's license. That's a nice feature when you get older. In case where are my glasses? You can still drive home. And it seems to me that since the surgery, my vision has been very stable. Every time you do a test here, things don't seem to change much. It's very stable. And that was just my comment.
No, I think you brought up two really, excellent points about cataract surgery that I really like patients to know going into it, and they realize after, of course, which is number one, when we're doing cataract surgery, we're removing a cloudy cataract for the sake of improvement of the vision, but we're also implanting an intraocular lens, which has the ability to correct the vision in the same way a patient would have refractive surgery. So we're able to, say, correct a nearsighted patient or a farsighted patient to what we call emmetropic, which means you don't need glasses. And typically that's for distance. Now, certain patients may be a candidate for what's called a multifocal lens, which would allow the patient to see not only distance but near at the same time. But that would be up to the patient to discuss with their doctor if they were a candidate for that lens. The other thing that you brought up that's quite interesting is, the speed of recovery, the kind of the ease of the surgery. So I think those are definitely positive aspects of the cataract surgery.
I was nearsighted before the cataract surgery, so I had to have glasses to see in the distance. Well, I'd worn glasses for like 35 years or so, maybe 40 years. So I just kept wearing them, except now they're the continuous lens. They're basically like window glass on top, and then they handle my farsightedness at the bottom, so I can focus at things that are reading distance away.
Absolutely.
Describe a little bit the procedure. How long it takes for a patient when they come to the operating site.
So when patients are scheduled for cataract surgery, we generally will have a consultation with them. They'll have some measurements for the intraocular lens that we were talking about. Patients are given a surgery date. They come to our surgical center, which is, basically a hospital without hospital beds, with an operating room suite. They're going to spend generally we tell patients to plan on being there about 2 hours. The cataract surgery itself will take usually on the order of somewhere between 12 and 15 minutes. But the whole process, we tell people to plan on about 2 hours. Everything needs to be very sterile and perfectly clean to avoid any kind of infection.
And part of that is applying the anesthesia, which is what, and then a period for it to wear off. And that takes a little while before the operation, and I don't know quite how long, maybe half an hour afterwards, something like that.
That's exactly right. And so when you have cataract surgery, modern cataract surgery typically involves conscious sedation, which would be some medicine through the IV to help you relax, be comfortable, to be pain-free. And then we typically perform cataract surgery topically, which would be eye drops to numb the eye. There's typically no needle or shot involved with modern cataract surgery, which is different than cataract surgery as I trained, 20 years ago when we did numb the eye with a shot.
All I can say is I didn't feel a thing. Absolutely no sensation of pain whatsoever.
Which is great, and we love hearing that from our patients, and that's fairly typical. The patients have a very nice experience. It's pleasant, and then ultimately they enjoy improved vision and an improvement in their what they're able to do in terms of improved nighttime driving, better visualization of television and street signs.
Well, that's I think a pretty good description of and I know that's something you do quite a few of, and I'm sure you try and because this is another drive for you to a different location, this facility, so you would schedule a number of operations at the same time so that you can kind of spend that day doing those operations maybe and not go to the other offices, I would assume. Yeah. Well, we've had a nice visit here, and we've really enjoyed looking at your facilities, and it's amazing some of the things that have changed in the field of ophthalmology. I mean, is that the right term, ophthalmology? No?
That's exactly right.
Okay, and but we'd like to kind of review your locations and times of operation and that sort of thing.
It'd be my pleasure. So we're in the Dearborn office on Outer Drive, and our office hours are generally 8 to 5 at our 3 offices, one in Southfield and one in St. Clair Shores. We generally accept new patients. Typically, those patients are referred by other eye doctors, sometimes primary care physicians, for evaluation of glaucoma and cataract. Certainly, patients who know that they have a diagnosis of glaucoma and cataract are welcome to call the office for an appointment.
And of course, you're treating patients that have macular degeneration as well.
We typically will evaluate patients for vision loss and vision problems, but generally macular degeneration is going to be treated by a retinal specialist.
But then you would refer them, so you would see the condition developing in a patient and then refer them.
That's exactly right.
Yeah.
Yep. So patients who are interested in finding out more about glaucoma, cataract surgery, or our practice, I'd encourage you to go online and search Glaucoma Center of Michigan. Ray, it's been an absolute pleasure to have you come. The folks at Kiwanis are so generous with their time and their energies, and it's so important to have groups like that in our community. I can't tell you how much I appreciate you being here. It's really a pleasure.
Dr. Citrin, we really enjoyed having you on Kiwanis Talk, and I want to thank you, and I want to also thank Kayla and Andrew for being in our a couple of equipment demonstrations during the show. And thank you for watching Kiwanis Talk, and we hope to have you join in soon.